Hi, we are going to introduce you today a new technology called robotic partial knee replacements. You are all aware that total knee replacements can relieve pain in elderly patients who have wear and tear inside their knee. This condition is called osteoarthritis, but sometimes this condition can affect younger people who are less than 50, less than 40 sometimes. These patients have tremendous pain in their activities of daily life. However, the total knee replacements can help them for about 20 years, and hence these operations are done only in elderly patients who are 60, 65 or older. So we have problem in younger patients who are less than 50 because they cannot manage their pain without operation. But unfortunately, we can't do an operation called knee replacement in these patients because knee replacements won't last their lifetime. So, a new technology or a special device called a Mako Robotic partial knee replacement can be inserted into these patients' knees. These partial knee replacements are very popular in many countries now because there are a lot of patients who will need some treatment for their knee pain in younger age group. In this operation, what we do is we resurface their knee with artificial implants only partially, unlike the total knee replacement where knee is resurfaced entirely. These operations are gaining popularity because they are smaller operations and they are quicker operations, and also patients rehabilitate very quickly compared to the total knee replacement. In fact, in many countries, these operations are done like a day surgery. Discharge happens within a day when they can do their basic activities of their daily life. Partial knee replacements are gaining popularity in this country also. So here you have a young lady who is in her late 40s with severe pain in her right knee since last 4 years. She has tried all kind of medications, physiotherapy and all injections and also several alternative medicines to get rid of this pain. Unfortunately, the wear and tear is not curable with any kind of medicines, and hence her pain got worse with time. Currently, when I did an X-ray, it showed severe arthritis only half of the knee on the inner aspect. We call that as a medial compartment of the knee. Rest of the knee is normal. And hence, we chose to treat her with a partial robotic knee replacement. Usually patients get admitted on the same day. Under regional anesthesia, patient will be operated with a small cut on the front of her knee, which is about 6 centimeters in length. With this cut, we expose the knee, we clean the knee, and also we inspect the knee for any other unexpected problems which you can't see on the X-ray. Patients had a CT scan of their knee done already. CT scan would have made a virtual model of the knee with proper measurements. These model will be used by the Mako robot to make the appropriate cuts on the bone accurately. As you can see now, a robotic pins are being attached to the bone, and there will be trackers which will transmit signals from bone to the robotic machine, which you are seeing now in this video. Once the robotic machine started communicating with the patient's bone, we do a process called registration. In this process, we map the bone surface using transmittable probes, and we map all of your bone surface so that the registration points are stored in the robotic machine. With this information, robot will know where exactly the bone surface is and where exactly the bone resection has to be done. Then we will confirm the exact position of your partial knee replacement using this model. We'll also do several tests to make sure that your movement is good and also the knee stability is restored, and you will have a good function in this knee using this virtual model. Once everything is confirmed, a robotic machine will come into the surgical field, and with the help of your surgeon, the bone resections are made. Note that the robot alone will not do all the bone resections or any part of the surgery. It is a robotic assisted process, and hence it is proven to be very safe. You can see in this video, the robot has removed the diseased bone and making cuts in such a way that the partial knee replacement can be placed in accurate position. Once the bones are prepared, we will put a trial temporary processes and again check how exactly is the movement, stability and alignment of your knee, both manually as well as digitally using the robotic machine. Once the trial reduction is satisfactory, the partial knee components are inserted and fixed using bone cements. Then the wound is closed in layers, and you will get some local anesthesia infiltration to relieve pain. And usually you are made to walk on the same day and mobilized to the bathroom toilet on the next day and discharged home. You will have to do little exercises for about 3 to 4 weeks at home, and in most of the cases patients are independent to their basic activities like bathroom, toilet within a day, and resume all their normal activities in 4 to 6 weeks time. So this is the x-ray done after the surgery. You can see the thigh bone and the leg bone and a small piece of metal which is inserted inside the half of the knee. Because of this metal piece or the partial knee replacement, bone and bone cannot rub, and that's why your pain will be relieved. Whereas on the other part of the knee, which is not replaced, you still have original cartilage. Because these knee replacements, called partial knee replacements, retain all natural structures of the knee, example, both the ligaments and the collaterals, and also the cartilage in the half of the knee, your knee should feel much normal and natural compared to a total knee replacement. These partial knee replacements have to be inserted in correct angle and also in correct alignment. If this alignment and angles are not properly done, the partial knee replacements are less successful. And hence, all over the world now it's been well recognized the partial knee replacements are better, or in fact to be done only with the help of technology like a Mako robotic machine. So in our hospital now we have this technology where we use Mako robotic machine to do this partial knee replacement, which is in fact one of the best methods available for this kind of treatment.